Hello, friends. Welcome back to the channel. Have you ever traveled to another country and gotten a hint that the people there seem especially happy or depressed? Have you ever wondered which nations are suffering the most? Today, hang out with me as I get to the bottom of this important issue with you, and the results might actually surprise you, as I think there are a number of misconceptions here. All right, just a reminder that I am a doctor, but I'm not your doctor, and this video is purely for educational and entertainment purposes. It's not personalized medical advice. So let's look at some of this data here. This is a study in 2019 on the prevalence of major depressive disorder. And on the left here, you can see these varying colors depending on the high or low prevalence of depression. So you're going to see more depression when the colors are closer to red and orange, and lower depression when it's closer to green or teal. So first of all, what you can notice here is that it's not obvious which countries are more depressed. They're kind of scattered around. We see America, Brazil, Australia, and especially closer to red, we have Iran, Morocco, Spain, Portugal, Tunisia. So there's no obvious pattern there, but one of the first interesting things to observe is that we have both rich and poor countries represented, and it's simply not true that America, Australia, and all these Western countries are happier per se. But the other thing to keep in mind is that a lot of these nations are in political conflict and turmoil, so that might explain some of the higher rates of depression, for example, in Iran, and perhaps also some of the African nations. But overall, there's no obvious pattern here. But we do see, for example, that Greenland has the highest prevalence, which is very concerning. And maybe that's related to social isolation or the climate or some other factors. All right, so let's try and look at another study here. Now, this one is from 2019, the Global Burden of Disease Study, and the higher prevalences are going to be darker, like closer to blue as opposed to yellow. And again, we see a similar pattern: America, Australia, Greenland, Iran, Saudi Arabia, a lot of Africa, but also these prosperous nations in Europe, like Sweden and some of these other Nordic countries, which are very egalitarian, socially egalitarian, as well as England, have relatively high rates of depression. So another factor underlying depression could be loneliness and a lack of social connection, nations that are more individualistic, as opposed to nations that are more socially connected and collectivist. We would expect to find more depression in the more lonely countries, the more individualistic countries. So perhaps that's what's going on here. It's not clear, but we do see resonances from the prior study as well. Let's look at this study, which tries to look at the year 2017. And here we have more depressed nations are going to be more red, and less depressed nations are going to be less red, closer to pink or tan. So here we see again America, Australia, a lot of Africa, Iran, Afghanistan, Morocco, Greenland, similar patterns. So we see a lot of these Asian countries are not very depressed, and a lot of the Eastern European countries don't seem particularly depressed. All right, so let's look a little bit more in depth into income and see what income might be doing to some of these rates of depression. So here we have a graph that looks on the left at the prevalence of depressive disorders from 0 to 6% or 7%. And then on the bottom x-axis, you see GDP per capita, and that's basically another way of representing income or wealth. And the first thing to notice here is that these are all of the nations across Africa, Asia, Europe, North America, South America. And there's no clear trend here that when you go up in income, you get more depression, or when you go down in income, you get more depression. It's a relatively flat line across all of the income categories, which is interesting. But if we isolate, for example, just the African nations, here's all the African nations here. You can see the ones that are in purple. They have relatively higher rates of depression compared to the other nations, and they also have relatively lower amounts of income. Now let's compare them to the European nations. What we have here is relatively lower on average rates of depression. It looks like it went from maybe 5% to something like 3.5% or 3%. So it looks like income is a correlate of depression, but it's not a humongous factor. And just to give you another contrast, again, here's the African nations, and then here are the European nations. The other thing to remember is these are just correlations, and there's lots of other confounding variables that go into explaining what's going on in a nation. And this is just a high-level overview. All right. Now, if we just look at the top 10 countries in the world that have the highest rates of depression, what do we see? Ukraine, and remember, this is before the Ukrainian war started with Russia. This was in 2017. And then the United States, Australia, Estonia, Brazil, Greece, Portugal, Belarus, Finland, Lithuania. So you have some wealthy nations there, some poor nations. And then here are the rates of depression that are the lowest in the world. The Solomon Islands, Papua New Guinea, not exactly a luxurious place. Micronesia, Nepal, Samoa, Tonga. So again, we see a mixed picture here as well. Let's unpack that a little bit more. Here is a study that looks at changes in rates of depression over time. This can be informative as well. So let's look at this more closely. What they did was they looked at from 1990 to 2017 to see which nations were changing in their rates of depression and by how much. So what you see here is that the more red the country is, the more it's going to be closer to the top in the change in depression, and the closer that you have to like a blue color, you have a lower or a decrease in depression. So all these African nations have changed dramatically, something like 100 to 200% increase in depression over those 27 years. South America is getting more depressed, Africa is getting more depressed, the Middle East is getting more depressed. America, Australia, Canada seem to be either holding steady or only getting a little bit more depressed. 25% more depressed, 50% more depressed. And then very few nations have actually gone down, like Latvia, but that's rare. Looks like the whole world is getting more depressed, unfortunately. And how can you interpret this trend? Well, it might be that there's greater industrialization, greater globalization, and greater social comparison that people are emerging in all these nations in Africa and South America. More interconnectedness, people feeling like they're missing out on technologies and luxuries and all these other things. There's basically global FOMO that's developing that may be contributing to depression. Who knows? That's just a speculation, but it is informative to see the rates of change over time as well. So now let's take a look at the other variables that I mentioned. It's a very complicated picture. So yes, wealth is definitely a factor, but so is political conflict. So is the degree of individualism and collectivism in a society. How lonely are people? How connected are they? Religiosity, meaning and purpose. We know people who are more religious are more happy. Religious participation is a protective factor against depression and suicide. And some of the patterns we observe could be explained by changes in religiosity. And then, as I mentioned, industrialization and globalization could explain the rates of change. These are just hypotheses. And it is a very complex picture, but at least we now have a sense of how the world looks in terms of depression. And knowing this may inform your larger picture of what's going on in the world. So if you've enjoyed this, please like and subscribe so I know that you want me to make more things like this. And if you find this topic interesting, I will suggest some products I find helpful. Thanks so much. Take care.